Hello, everyone. We're going to just wait a couple minutes to allow people to slowly come on in. We'll get started in just a minute here. Welcome, everyone, to the Wheelchair Sports Concussion Protocol session of the virtual Great Lakes Games. We at GLASA are so sad we aren't able to see you in person this year, but we're thrilled you were able to join us for this session. We first want to shout out and thank our wonderful sponsors for this event. Before we begin, I want to go over just a couple of housekeeping items. In order to avoid any background noise, all attendees have been muted for the duration of the session. If you have any questions for the panelists, please make sure to use the Q&A button rather than the chat. When using the chat function, please make sure to change your message to be sent to all panelists and attendees. Feel free to introduce yourself and where you're from. Without any further ado, I'd like to introduce your presenters, Dr. Michael Harper, Physical Medicine Rehabilitation Resident at the Medical College of Wisconsin, and Dr. Ken Lee, Associate Professor at the Medical College of Wisconsin. There you go, gentlemen.
All right, thank you very much. I'm going to share my screen now. All righty, there we go. Thank you for everybody for attending. So like you said, I'm Dr. Michael Harper. I'm one of the residents at the Medical College of Wisconsin here. I'll be talking about the wheelchair sports concussion protocol that we'll be kind of implementing going forth here. So to start out, just giving you a little bit of an outline. We'll talk about a little bit of background about concussions, talk about the importance of baseline concussion testing, and then the different components of what are in the baseline concussion testing and what the athletes can expect to go through, and then what can the athletes and coaches do in terms of concussion and what do they need to know. So as a background, we kind of started this project from having many different adaptive sports athletes being knocked out of the chairs and kind of hitting their head on the ground, and then having difficulty assessing them because we didn't really know what their baseline impairments were. And many baseline impairments can mimic what a concussion symptoms could be. So we kind of delved into what are these challenges, and then trying to implement some different strategies to mitigate those challenges. So starting out, just definition of what a concussion is. So a sports-related concussion is a traumatic brain injury. It's typically caused by either a direct blow to the face, head, and neck area, or elsewhere in the body that the force is then transmitted to the head. Symptoms are normally rapid in onset, and I'll go over what those typical symptoms are on the next slide here. And they normally resolve spontaneously. A big key thing is it may or may not involve loss of consciousness. And these clinical signs and symptoms cannot be explained by comorbidities. And that's very important in the adaptive sport athlete, that their baseline function needs to be kind of understood so we can differentiate what is due to their comorbidity versus what is due to this potential head injury. So that, like I said, that mechanism of injury is either a direct or indirect force to that head. So it can either be the athlete falling out of their chair, hitting their head directly on the floor, or it can be a whiplash from a collision of getting like checked in wheelchair lacrosse. There's a few different kinds of stress the brain can have. It can either be a stretching kind of stress. There can either be a shearing, like a rubbing kind of stress of that brain on the, or it could be a compressive. So the brain hitting the side of the skull there that can cause these different types of stress resulting in concussion. These are a list of many of the common symptoms that are concussion, with headache, nausea, vomiting, dizziness, imbalanced issues, feeling so down, fatigued, trouble falling asleep, drowsiness, sensitivity to light or noise, that loss of consciousness that we discussed, the blurred vision, some difficulty concentration or remembering. And one of these challenges is due to some of the impairments of if somebody has a history of MS or if somebody has a history of a traumatic brain injury, some of these symptoms might also be what an athlete experiences at baseline. So we have to kind of differentiate, what is this a baseline or is this due to the head injury that has potentially occurred? Some of the complications of concussion, and why are we concerned about concussion? So a few of the known side effects of, let alone from the initial symptoms, but there's a syndrome called post-concussion syndrome, which the symptoms last longer than typically expected and sometimes can last months. So we want to be able to avoid that scenario. The most concerning complication is what's called second impact syndrome. So if somebody gets a concussion, gets hit again before the brain is healed, resulting in another neurological insult, they can have this vascular congestion, and that leads to death. And that's due to the brain not be able to regulate the blood supply and causes too much pressure in the brain. And that happens fairly rapidly. The adolescents and boxers are the athletes that are most at risk. In the adolescents, because the brain is still developing, and boxers, they're more likely to get that second impact competing in the ring. Another force of emphasis too of the complication of concussion is talking about the chronic traumatic encephalopathy. And really, we're starting to do more research on fully understanding it, of what that disease specifically is, what the risk of that disease, but we have to do more research to fully understand that piece of that puzzle. So talking about concussion and how often does it occur, we first kind of look at what is the incident rate in able-bodied sports. Do we need to be worried about in adaptive sports? So looking at these numbers of women's gymnastics of 2.6%, women's hockey of 21.6%, men's hockey is 3.6%, and women's basketball is 6.5%. And then on my next slide here, we look at one study that was done in wheelchair basketball players, and they found a 6.1%. So when you compare that to the able-bodied basketball players and those numbers, they're fairly comparable. So it does occur in wheelchair sports, and so it's something that we should be paying attention to. Also of note, the study also looked at the bottom bullet point of many of the wheelchair athletes did not report their symptoms, and primarily they didn't report it because they didn't want to be removed from play. So educating of the importance of why do we need to discuss and why do we need to report symptoms, as well as another point of emphasis for education. So points of baseline testing, I touched on that earlier, but each wheelchair athlete is unique. So many of the athletes have different comorbidities that can mimic the signs and symptoms of a concussion. So they might have had a history of a traumatic brain injury, a spinal cord injury, CP, an amputation, stroke, MS, etc. And that clinical picture does confound of what a potential head injury could be. So it makes the evaluation very difficult if the baseline is unknown, because anything that we find on an exam that could be related to a head injury, we then have to assume for the safety of the athlete that it's due to that head injury, and potentially have to withhold them from returning to play. And like I said, yeah, having that baseline testing is going to help us make that decision of return to play. And our whole goal is to be able to have athletes return to play safely. And we can do that with better confidence of having this baseline data. So kind of giving an example here, James is a 29-year-old wheelchair football player, and he's a spinal cord injury, has a history also of a TBI as well. He gets knocked out of his chair and hits his head. And when I assess him as the medical staff, I find that he has multiple symptoms that are potentially consistent with concussion. He has some pressure in his head. He reports some balance problems, some irritability, some difficulty concentrating and remembering. And when I test him, he also misses some points for his cognitive and balance exam. Without a baseline exam, I'm not allowed to return him to play because I have to assume all of those things are due to that head injury. But luckily, James has a baseline test, and I find out that the pressure in his head is actually due to sinuses and allergies that he has. The balance problems that he has are due to the spinal cord injury. And then his irritability and difficulty concentrating and remembering are due to his previous traumatic brain injury. That points that he missed on his cognitive exam are due to, and that delayed recall are due to that history of traumatic brain injury, and he's at the same as his baseline. Also, those points he missed on baseline testing are also due to that spinal cord injury, and it's consistent with his baseline testing. And after knowing that, I'm able to confidently and safely let James return to play and rule out a concussion in that scenario.
I think it's important to point out that, again, if you didn't have that data, or if you didn't have that baseline testing, James would have been pulled out.
Exactly.
For the wrong reasons.
Exactly. So if you're talking about what are the components of this baseline testing for the wheelchair athlete. So the protocol that we developed is based off of the SCAT-5, which is the standard for able-bodied athletes, and addressing each of these sections of the evaluation of knowing what symptoms, what are coming from the symptoms coming from the disability, the cognitive screening, what is that athlete's cognitive baseline, their neurological screening, and the balance, and how do we assess balance in a wheelchair athlete is another challenge. And then testing, again, delayed recall and the cognitive, what is that cognitive baseline. Other things that we need to do is make sure that it's cost efficient, not very equipment intensive, and then takes minimal time so we can get you back onto the field and as soon as we can safely. So the different parts of the concussion management protocol, and I'll be highlighting these baselines for the off the field exam, is that concussion history questionnaire, the symptom checklist, the cognitive screening, and then the balance testing, as well as a King-Devick as well. So the next slides, I'll just briefly give you an introduction of what they are, and we'll go into more details later on in another session of actually how to perform some of those testing for our coaches and other support members.
So for this particular session, because we're actually talking about this for the general audience, so Dr. Harper is just going to go through briefly what that is, just to show you what it is.
Yep.
But our plan is that if the GLASA members who are part of the medical team, or the coaches, the managers, who wants to actually learn how to do this, we can have a separate session and go through these protocols a little more thoroughly and give you instruction how it's done. So we can do that in another time once that's set up. But he's just going to go over generically what this is for our general population here today.
Yep. So that questionnaire, we kind of get the baseline information about the athlete, of who you are, how often, what are your, how do you get around? Are you in a manual wheelchair, power wheelchair, walker? Do you use a cane? What sports do you participate in, and how long you've been participating in those sports? We then also get a concussion history. So we have a definition of a concussion on here, and we just are asking, have you had a history of concussion, how many you had, and then what the timing of that concussion is like. Getting some information about, was it sports related? Was it potentially in, if you have a veteran that's during their deployment from a blast injury, and then if they reported their concussion or not, who they reported it to, why they didn't report the concussion. So this is just that standard fill out. The next section is looking at the symptom evaluation checklist. And this is kind of, again, at the baseline of knowing of what this athlete is, has symptoms at their baseline. And so it's a 0 to 6 scale, 0 being no symptom, and then 6 being severe. And we have you rate it in each of these categories, and you just circle which one you feel at baseline. And then we'll be able to use this again in follow-up of if there is a head injury, that what was your baseline symptoms compared to what symptoms you're feeling now. The next section, talking about the cognitive screening, which is the standard assessment of concussion. It tests orientation, immediate memory, concentration, delayed recall. It's a useful test because a one drop in point is very sensitive and specific for concussion. So having that baseline data is going to also help us evaluate the cognitive piece. So this is just an example. So these are some of the questions that we're going to be asking of orientation, memory, asking you to concentrate of how to count numbers, and then also asking like some of the delayed recall questions. The next section is actually testing some balance. So that'll be the wheelchair error scoring system. We'll be asking you to be in 3 different positions, and I'll have those positions on the next slide. And then testing your balance in eyes open, eyes closed. And this is primarily for manual wheelchair users. It's difficult to perform, and then those manual wheelchair users that can perform a wheelie. So these are the 3 different testing positions: seated at a table, sitting on a balance disc or being able to do a wheelie. For those athletes that are unable to maintain those positionings or believe that it's unsafe, we actually have an alternative test that we'll be implementing called the King-Devick, which I'll talk about in a second here. So here we just ask you to maintain that position, and we'll be kind of scoring any errors if your hands come off your waist, etc., to kind of determine of how well your balance is at your baseline. And we can, again, compare that to if you have a head injury. Is that a change, or is that consistent with what that baseline test is? Here's just a few of the examples of the errors that we're going to be looking for. And again, we'll go through much more detail for the coaches and other support staff that are interested in learning how to perform this test on their own at another session. So the next section here is talking about the King-Devick, and like I had mentioned, that this is kind of an alternative for our non-manual wheelchair users. So somebody that's in a power chair, or even if an individual that is an amputee that normally walks around with their prosthesis and doesn't use a manual wheelchair at baseline. This is a testing that'll test kind of their vision and how well they're able to track left to right and read off of those numbers and their concentration with that as well. So we ask them to read the numbers from one side of the screen to the other. And there's a few different, and it gets harder as we go on, and we just say how long it takes to be able to perform that test and be able to read all of those numbers. And we'll be able to compare that, again, time that it takes at baseline to that time that it would potentially take you after that head injury. So this is just an example of our scoring sheet for you. We also do have a return to play protocol. This is something that's going to be directed by a medical provider, but we do have something in the place of that you'll have to complete if you are diagnosed with a concussion, and we'll progress you back to kind of activity before going like full go. So you have to do some minimal activity at first, make sure you tolerate that both symptom as far as your symptoms, be able to then progress that to the light activity, moderate activity, getting some sport specific activity, and then eventually getting into a full contact practice before being able to play in a normal game. And again, that'll be directed by medical personnel, but we are working on developing a specific return to play protocol that is sport specific for wheelchair sports. So now, what do athletes and coaches need to know, and what can coaches do here? So again, I have the slide up again on the complication of concussion, of re-emphasizing of it is important to understand that concussions are serious, that we can have those prolonged symptoms. If you get another concussion after you have that first one, that second impact syndrome, it can result in very severe brain injury or even death. And then also that risk of that CTE as well. So understanding that there are complications, it isn't just part of the game. It is something to report. So really emphasizing here, report your symptoms, tell your coaches, tell your parents, tell your doctor or other medical personnel. Again, concussions are not just part of the game. They can be serious. And if mismanaged, like I said, can really lead to very unfavorable outcomes. So these is now some just take-home instructions. So if somebody does have get a concussion, of what are the things that they need to look out for? Changes in behavior, worsening headache, vomiting, double vision, dizziness, new numbness, tingling, excessive drowsiness, or slurred speech. So those are the things that are a change from kind of that baseline, and things that are getting potentially worse after that initial evaluation. Some general things to avoid: we don't want you to be drinking any alcohol if you have a head injury. Driving a car, any motorized vehicle should avoid that as well. Doing anything strenuous, especially or put you at risk of having another injury. Avoiding crowds, especially because it's like loud noises can exacerbate some of the symptoms. And then avoid taking certain medications like aspirin, Aleve, ibuprofen, or other anti-inflammatories without the direction of your physician, and avoid sedating painkillers as well. Trying to avoid screen time is another thing too, that the being on the screen and having to focus for long periods of time can also exacerbate some symptoms of that concussion. Things that are okay to do and things that you should do is rest. Applied ice. If you also have a hurt shoulder, you can ice other injured areas. Make sure you're eating nutritious meals. Tylenol is okay as directed, as well as then drinking plenty of fluids, either Gatorade or water, making sure you're staying hydrated. We've also developed a concussion fact sheet for coaches too. So these are things that what coaches need to know. This is, again, it's talking about what a concussion is. How do you tell if your athlete has a concussion? These are some of the common symptoms that our athlete might be able to, you might notice, or something that an athlete might be able to tell you, is telling them that they're dizzy or that they have nausea or they're difficulty remembering. And it's also important to recognize that no two concussions are the same, both on the athlete level as well as the coaches level, that two athletes that have a concussion might act differently. Some might be more severe, some might be more mild, and each one needs to be treated on a case-by-case basis. Here's a nice little spreadsheet that I really like, as far as what can a coach do to keep wheelchair athletes safe. And it breaks it down into different parts of the season of in the preseason, in season, time of injury, and recovery. So in the preseason, really creating a culture that athletes feel comfortable reporting a head injury, and it's encouraged. Because athletes that know that seek immediate care are going to have, or that don't seek immediate care normally take longer to recover. And then some of those tips of being present in your team and having medical providers, like having talks like this is what GLASA is doing, is being able to discuss the strategies of what a concussion is. So all of those things are important. And then in this season of knowing what a concussion, what it looks like, and being able to identify and seeing an athlete that just hit their head and watching them and looking at them and asking them and talking with them about, are you having any of these symptoms? And if they are, having them sit out and they can be evaluated by a medical provider. And then again, yeah, like I said, at that time of injury, of making sure that they get fully evaluated, and then following that proper return to play protocol, as well as that's developed by the medical provider, and making sure that they don't have another or put themselves in a dangerous situation before they fully recover. Because coaches do play a very powerful role in setting the tone of safety in each team. So that's very important in there. Some of the things too is what happens, like we've mentioned before, if an athlete it gets a concussion and keeps practicing, like again, that severe, that second impact syndrome, like I had mentioned, or the prolonged symptoms as well. So these are just some more facts about that and re-emphasizing it. And this is an all-in-one handout that coaches should be able to have. Again, that long-term effects of the concussion, that CTE, that there's a lot of research going into right now, but knowing that there is a potential risk of that disease, and that we don't fully understand yet. So that's another thing of making sure you're limiting multiple concussions or even multiple micro traumas as well. So like you notice, like the NFL, they don't have padded practices every single practice. So also for more contact sports, is limiting the contact drills, and so that it's only as needed and they have a specific focus and a specific aim, that you're not causing this potential contact without an actual purpose to that contact. And then again, I mentioned that repetitive head injuries, and then talking again about that repeated force as well. And then also here of knowing that concussions are common, like I've mentioned before, that the NCAA has posted that at least one student athlete per team gets a concussion every single season. And then that each sport, and like we're presenting today, does have a concussion management program, and making sure that you're following that wheelchair athlete's recovery as well, and doing that return to play decisions and guidelines. And then if you need any other extra resources beyond of what we're providing today or what we have, the NCAA has a really good website discussing of what concussions are. And they worked with the U.S. Department of Defense to develop a lot of this concussion initiative. This is something too that we had for the National Veteran Wheelchair Games, of just a participant concussion awareness information sheet that we'll be talking with GLASA about having a version of this as well for athletes to sign, saying that they understood of what a concussion is, and that it is their responsibility as well, if they're experiencing it, to report that concussion to a medical provider, or if they see a teammate that has these potential symptoms, that they have that responsibility to let a medical provider know. Some things that we are doing and working on for future plans for concussion care is we're working on putting together a handbook. So being able with 20 different international experts to help with the evaluation and management. So somebody can have that on the sidelines. If a medical provider isn't there or a healthcare provider is there, they can use this handbook to get a better understanding of how to evaluate the unique challenges in that wheelchair athlete. as well. And we'll also be working on developing not only doing in-person training as virtual training like this, but also developing educational videos that we can refer back to and how to perform some of these maneuvers and how to overcome some of these obstacles. So at this point, pause and kind of leave it open for any questions. Yep. Let's see if I can open up.
So there were a couple that came in. The first one was from Steve, and he asked if baseline testing was covered by health insurance.
So that's something that if it's the provider is your primary care physician and they know how to do it, they can roll that into like your yearly physical. But other things too is if we're able to have healthcare professionals like myself or Dr. Lee educate coaches and educate yourself of how to fill out that first half on your own. Hopefully we'll be able to get all of this done without any cost to the athlete. That is the goal.
So to add to that, you know, the baseline testing is for sports.
Mm-hmm.
It's not in the say kind of the medical providers forte.
Mm-hmm.
So insurance probably won't be covering it if you're just doing this as a standalone exam.
Mm-hmm.
So like Dr. Harper said, if it's part of your annual physical or sports physical,
Mm-hmm.
whatever insurance covers, then it'll fall into that. At the VA side, it's part of our, it's going to be part of our medical evaluation for medical clearance for sports. So it's part of our electronic medical records as well. So all this thing that Dr. Harper talked about is in our, it's a template in our VA medical records.
Exactly. So, and then I see, this other question from Ethan here about the balance difficulty because of their disability and how do we know if it's from the head injury or not. And that's one of the reasons why we're getting that baseline and doing that WESS exam, that wheelchair error scoring system, is be able to get a baseline of what the balance is, and then also being able to compare that to what you're currently now. So if you have a significant change from that baseline, then we know that that new that head injury could have caused that worsening balance.
So Ethan's question is exactly the reason why we're talking about this.
Exactly.
Unlike the able body, in general, you know, they don't have a baseline testing, but in general, we can tell, hey, that guy's walking funny after he got hit.
Yep.
You know, before he was running around doing fine. But many of you guys in wheelchair, if you get hit pretty hard, you may be able to still wheel around and we never see any imbalance with you, right? But if we have a baseline and do a baseline testing and then compare it with post-concussion testing, then we may see a difference. So Ethan, very good question, but this is the entire reason why we're doing this.
Yeah, thank you, Carolyn. So yeah, housing this information. So yes, it is part of HIPAA. It's somebody's medical person information. One of the things that we have here on our VA servers for our veteran athletes is Excel document that we can have everything organized, and that's something that we'll be able to, we could share the template for that. But if we maybe wrap into the concussion awareness waiver, or saying that they will report their concussions, if you also say that it's giving permission to house that data in whatever database that you have that's secured, that the athlete can also give that permission to have that medical information kind of wrapped in so it's covered and that is secured.
So all HIPAA regulations should be followed.
Yep.
Because there is medical information involved in this thing. So it all depends on each organization's process of that. So if GLASA has a process of collecting medical records, let's say this concussion management protocol, what do you do with it once you do the exam? Let's say you got sheets of this SAC exam and other exams. My preference would be a copy should go to the individual doctor, so that doctor actually has that baseline, right? And then the other thing is if GLASA decides to keep a spreadsheet of this, so it can be used by your coaches and stuff. Let's say I use Ethan, for instance, you know, if you got into a concussion, your coach does this quick exam and finds, okay, there's something here, but I got to do a comparison, like that James example, right? But she needs to have something to do the comparison with. So I would suggest, like organization, have a spreadsheet of this who has a restricted access by medical personnel only who can do this comparison. Of course, you know, the organization may have a process saying, in order for us to do that, we need a waiver signed by the each individual athlete that we will be keeping a record of this at this point, and it will be secured in this way. That all needs to be processed and set up. Good question.
Yeah.
So another one here is it recommended to also have a baseline MRI done?
Yep, there's no need to have a baseline MRI.
Okay,
Insurance
next
company
one
will
is,
cover
are you,
Yeah, insurance will not cover a baseline MRI, no. And then the balance test is with the eyes open and eyes closed in those 3 different positions. And that's what is the modification from that balance error scoring system to that wheelchair error scoring system. So following it for those manual wheelchair athletes of that wheelchair error scoring system. Now, if an athlete is ambulatory at baseline and they feel that they can complete the balance error scoring system, that also will be available. But there's not many of our wheelchair athletes that are able to safely complete that balance error scoring system.
Now, Kristen, I just want to say, WESS test is not ours. That was actually developed by different physicians, actually ATC,
Yep, ATC,
who
PhD.
developed it using wheelchair basketball teams.
Yep.
And then it's not the best thing out there, but it's the best thing out there. So for us to use, there's nothing else at this point to do a wheelchair balance testing. So we are using that. We're hoping in the future, once this COVID-19 is done, do some more validating testing on that as well. But it's the best we got so far.
Yeah, and then I can send a copy of the slides out and then to GLASA, and they can distribute that.
we can make sure that all the attendees receive this PowerPoint. But to elaborate on that, so this baseline testing that you guys are referring to, how would someone come across this? How would they get access to this to use on, you know, their athletes, or, you know, to look further into it?
So the current version that Dr. Harper has put together, and several of us have reviewed it, it is available. We were sharing with anybody who wants it. We would ask that they really know what to do with it, so you're not doing it wrong or incorrectly. So that's why for the GLASA group, you know, those professionals who we would like to do a training session on that. It doesn't take long. It's a very easy test, actually. And then share it. I think, if I'm not mistaken, we already shared the CMP with you guys, right? That you can either post it on your website or share it with anyone who wants to see it. But it's mainly for those coaches and anyone else who can actually perform the test. Yeah, we want to share it as widely as possible.
Yep. And that's one other thing that we're working on as well, is that handbook as another thing that eventually converting this into the handbook, but then also talking about these challenges and having that available. So that's something that we're in production of, starting to plan that process of creating that.
And then another question here. So you mentioned that the return to play should be directed by a medical professional. Do you also suggest having the original baseline test conducted by a medical professional, or could that be a coach or a program coordinator?
So someone that's gone through the training and understands how to do it can complete that baseline exam, but they have to kind of go through either talking with us or another individual that's been trained in how to do it, and kind of checked off of making sure that there's some consistency there, that they're able to do it reliably. The coaches or another assistant could be able to get that baseline data for us.
So bottom line is, yes, anyone could do it who's trained. It doesn't have to be a doctor.
But the return to play and that evaluation is something that is directed by medical personnel.
Wonderful. So those are all the questions that we've had come in so far. If anyone else has questions, please go ahead and use the Q&A function, and we'll make sure to get those answered. Dr. Harper and Dr. Lee, would you guys, do you have a slide with your emails on it by chance that you could show for everyone right now?
I don't have a slide saying that. There's just my references there.
Make a slide
Let me.
now. Okay, he's making one right now.
Yep.
Perfect.
All righty. Let's minimize this. And then insert.
You're seeing this too, right?
It stopped. Yeah.
Dr. Young in there. You sure you got that right? Okay.
Yeah, I just moved it. And then
Is it Michael or Mike? Who? Yours. MU line? No. Michael U line?
For the VA,
Yeah.
Michael dot
oh yeah. H.
LEIN at
Yep.
VA.gov.
VA.gov. Alrighty.
Okay.
I'll reshare the screen once I can get this back up. Back into Zoom. Oh, here we go. Open here. Share screen. Sure. There we go.
So yeah, we had Dr. Uline. He's here as well. So he's been one of the culprit making our lives miserable.
So.
So there was another question that came in. What about completing a VOMS for baseline?
So yeah, that's another area of things that we're going to be talking about. It kind of are with making this handbook of having that as an option as well. We haven't explored that opportunity and haven't explored doing that specific test, but that's something we're going to be talking about.
Yeah, so that will be part of our 20 experts getting together
Yep.
To develop basically a 6-chapter book and a little sideline examination pullout for coaches and people. They're all real good questions.
They were very engaged, which was wonderful. But I just want to point out, we had people from all over the country on this call, as far as Washington State. So we really had quite a far reach, and then all the way to DC, which was very exciting.
And so anyone who wishes to for us to present this to your group, let us know. We can do a very simplified learning version of the CMP, so you guys could actually go ahead and do it. Because many of the coaches and trainers and owners, managers, program directors, we don't need to go through the history of concussions and all that. We can just go through the baseline testing and the future testing right off the bat, and it will probably take 15-20 minutes, especially if people understand the concussion and adaptive sports aspect of it. And it's really not hard to learn. It's actually very simple.
Mm-hmm.
Can you give us some examples of what other types of exercises or drills or things you'll request from athletes when doing a baseline testing, just so our athletes have an idea of what they can expect in going through this?
Actually, there's no specific exercises. If you look at the picture that Dr. Harper is showing, you're sitting on a balance disc in your on your table without balance disc. Do your little process for 30 seconds, and then you sit on a balance desk, and then do the same thing, eyes closed, eyes open, and then you do the wheelies. That's pretty much it. Those are the 3 procedures, I guess, that you do. Yep. And it's a very quick, down and dirty exam.
Yeah, so yeah, again, kind of just to recap. So I'll go back to this slide here. So, well, there's a history questionnaire to fill out that the athlete does. There's the symptom checklist that the athlete does. And they can do that on their own for the baseline part of the exam. There's that cognitive screen, that SAC exam, where we're just asking a bunch of questions. There's that, then there's the balance test that we just showed. And then the King-Devick is being able to read those numbers. And then kind of go back to there. So those are the different components of the baseline that we're going to be asking athletes to do.
So I guess those of you who are going to do this, the only thing that you really need is the balance disc. It's a little cushion, air-filled cushion.
And a table.
Yeah, and a table.
So, yeah, and most people have smartphones for the watch now and everything like that. So, stopwatch.
Well, that was perfect. Thank you, gentlemen, for that. We really appreciate. And if we don't have any more questions, we can go ahead and end the session. Dr. Lee and Dr. Harper have their emails here. If you have questions for them or would like to know more information, we'll make sure that I have a copy of their presentation, I would say next week. But otherwise, we hope you'll join us for any of our other sessions throughout the week, going until Sunday afternoon. Thanks again for attending, everyone.
Thank you.
Thank you.
Good job. Getting good. This is